ever had a very serious cough that you cough, the cough extends into weeks, months, and even years? You know, the problem with this kind of cough is that it's very embarrassing. You cannot go for function, you cannot go out, you cannot mingle. In short, it may even disturb your sleep. So in this video, we shall be looking at what could be the possible causes and what you can do, how it can be managed, what you yourself can do to help you with the cough. Hello everybody, welcome back to my channel. I am Dr. Isioma. If you are watching me for the first time, you are in the right place, because in this channel, all what we do is about giving tips on how to live a healthy life and being in health, making you to take charge of your health. So do well to subscribe to this channel so that you'll be having updates on any new videos I post. So let's go into today's discussion. Today we shall be talking about cough. You see, some cough can be very irritating, very annoying. You will cough from Monday to Sunday, from January to December, or sometimes it may even be coming three monthly, and you seem not to know the reason behind it. Or you have done every other thing and you seem not to have achieved any results. This video will clarify everything. So I urge you to watch this video to the end so that you'll be able to maximize all what we will be discussing. Every details I will be putting up in this video. For chronic cough or persistent cough that has lasted beyond 2 months, 3 months, in years, and this can be very frustrating. It can be very disturbing. Not just disturbing, it can cause a lot of issues. You don't know what to do anymore. It disturbs your sleep. It makes you feel sad. You are so tired, and it'll make you not to sleep at night. For you to even reason well, it will disturb because you are not getting adequate sleep at night. Sometimes this kind of cough can even make you to be urinating on yourself, what is called urinary incontinence. There is a point we cough up to. You will cough, urine will start leaking out of your body. It may even result in what we call hernia, whereby there will be swelling in some areas of the body, like the bronchus area, the tummy area. Now, let's look at what may be the possible causes of this kind of cough. Number one, postnasal drip. That is catarrh coming from your nose into your throat. So in this kind of person, you may have runny nose, you may be sneezing, you may have what we call sinusitis, you may have allergy. So you're having catarrh dripping from the back of your nose into your throat. That will now irritate, it continues to irritate the airway, the air passage, and that can trigger cough. You will feel as if there's so much phlegm, so much mucus in the throat. It could be as a result of postnasal drip. If the cause of the postnasal drip is not addressed, it will continue. The second reason why you may be having the cough that has refused to go is reflux, gastric reflux, known as GASROESOPHAGEAL reflux disease. And this happens when the content of the stomach goes upwards into the throat. It can cause irritation, it can cause some spasm of the airway, and that can result in cough. And this kind of person usually complains of cough more at night or when he lies down. And this kind of person may even have some other symptoms that will give it out, like heartburn, having sour taste in the mouth. The third reason why your cough is not going away may be as a result of asthma. You may not have been told that you have asthma, but you may just be having cough. This kind of cough usually happens early hours in the morning, like towards waking up, 4-5 a.m. Then it also may be with some difficulty breathing, or you're having shortness of breath. You feel as if you're not breathing well. It can happen both in adults and in children. So having a persistent cough may be due to asthma. The fourth reason why you may be having this cough that is refusing to go is allergy, which is body react to certain things in the environment. It may be dust, It may be a flower you just planted in your house. It may be your pillowcase, depending on the kind of material that it's made up of. Your pillowcase, your bedsheet. It may even be the pet you kept in your house, your pussycat, your dog. Now, it may even be perfumes. In short, it may even be from your rug. Yes, that rug you have in your sitting room, in your bedroom, may be the reason why you are always having cough. It may also be mold. You know, some houses, when a house is already soaked with water, some green or black thing, mold can start growing from there. It may be a reason why you are coughing. So allergy is one of the reasons for a persistent cough, a cough that is refusing to go. The fifth reason why you're having cough that is refusing to go may be due to smoking. You may say, I'm not a smoker, I don't smoke, but what about people around you? What about your spouse? What about your children? You may not actually be a first-hand smoker, but you may be what we call a second-hand smoker. So if you are exposed to smoke or you smoke, it may be a reason why that cough has refused to go. The sixth reason could be what is called chronic obstructive pulmonary disease. It is a problem within the lungs whereby the lung has been exposed to certain issues like smoke, and the lung is no more expanding as it's supposed to expand. Another reason why you may be having chronic cough or cough that has refused to go could be due to infection of the lungs and the air passage. This infection can be viral, it can be bacterial, it can be due to a fungal infection. This includes things like COVID-19, whooping cough in children, pneumonia both in children and in adults. It could also be TB. Another reason the cough may have refused to go is food sensitivity. This is different from allergy. Some people are sensitive to certain foods like food containing gluten, eggs, milk. So if someone is sensitive to this food, it can trigger some reaction that will not cause cough. It could be as a result of cancer. Cancer may be a reason why that cough has refused to go. Maybe a cancer of the throat or a cancer of the lungs. Then it may be due to drugs, like drugs that we use in treating high blood pressure. There's a group of drugs that we use in treating high blood pressure that the side effect of the drug is cough. So if you're hypertensive and you're having cough, it is good to check your drugs with your doctor. It may be a reason why you are having cough. It can also be due to heart failure. Problems with the heart can be a reason for your continuous coughing.